Today I will talk a few words about a project we are taking part. It's a joint action on chronic respiratory disease. The acronym is JARE. Of course, as a rest of the joint action project, it's conducted under the EU for Health program. In this program, we of course we are interested in the chronic respiratory diseases. There are 14 countries involved, and together there are almost 38 institutions involved in this joint action. This number is still growing because new partners are still joining to us as associate partners, as you know, these procedures. The head of the whole consortium is National Coronary Institute from Hungary, and the leader of it, the Professor Liko Horvat. We start our work at the December 2024, and our project should be ended till the end of the November 2027. Today I represent my team. It means Warsaw Medical University or Medical University of Warsaw. This is our core staff. You see a group of experts from different fields of expertise. Especially, we've got the Professor Bolesław Samoliński, the allergologist, immunologist. Also, we've got Dr. Joanna Hermanowicz-Salomon. She's a pulmonologist. And most of us are expert in the public health area. And also, we've got some expert in communication. It's a core staff, but there are also more people involved in that project at our side. And of course, we cooperate also with the National Health Fund, and we are still in the contact. Today, we try to present some our activities under this JARET project. There are 8 work packages. The first 4 is about the communication, project management, and some administration work. But the most interesting are the last 4. It means from work package 5 to work package 8. Our university is involved in the work package 5 and work package 6. My colleague, Paulina Mularczyk-Tomczewska, will describe our activities under some of them, and I will also add a few words about that. In general, the huge challenge under this program is it's absolutely multidisciplinary. We connect their issues from the allergologists, pulmonologists issues, public health, but also tobacco control, problem of the vaccine hesitancy, and other very important issues connected with the health status and approach to the global health. We also are very interested in the division of work between the primary and secondary healthcare. And in this moment, I will ask my friend Paulina to describe some of our main activities under the VP5 and VP6. Paulina, you are with us.
So good morning, everyone. Once again, first of all, I would like to thank you for the invitation to today's session. It's, as Filip said, is an honor to take part in such important event. I will kindly ask Filip to move to the next slide in the next few minutes of my presentation. I think it will be better to cooperate. I would like to present you the contribution of Medical University of Warsaw in this project, focusing on our engagement in the Work Package 5 and Work Package 6, where we concentrate on prevention, on early detection and coordination of our care of primary and professional care. Our role focused on three main areas: the supporting communication about vaccination, as Filip said, strengthening tobacco and nicotine prevention, and improving early COPD and asthma detection and healthcare system coordination. Our first task in Work Package 5, the task 5.1 about vaccination and early childhood infection prevention. In this task, the leader and also Medical University of Warsaw, because we are involved in this task, focus on the most effective way to protect lung.
Okay, so thank you, and forgive us for some technical issues. It's always some risk when we try to go offline, online, or hybrid. So about the VP5 and our activity under the VP 5.1. This is about the vaccination. It's one of the, I suppose, the vaccine hesitancy is one of the 10 most important global health problems. It was mentioned by WHO before the global pandemic. So we continue work on that. Our team specialized in this issue. We spent 4 years on research about the vaccine hesitancy in Poland. So it's a great opportunity for us to continue our work under the JARET project. Our team just taking part in the international group, which preparing some questionnaire study, which will be addressed to medical staff about the main issues which they can give us information about the problem they found in their work, especially the primary care physicians and nurses, because as you know, the most important issue is to convince people about the safety and the reason to vaccinate themselves. And the second from the VP2 project, is about tobacco control. And unfortunately, Poland is still the country with the relatively high level of the tobacco use. Currently, we observe new threats as new tobacco products, especially e-cigarettes, heated tobacco, which change a little situation in our country. For a long time, we have got very high level of very high percentage of people using the tobacco. After 2010 and the new act about area which are free from tobacco, we observe in the 10 years a little decrease in these numbers, but unfortunately now we still observe some increase. So we observe that situation, and our project address also this issue, especially towards the three very important group, pregnant women. We also would like to train and educate young people at schools, because we know that the first contact with tobacco is at this level, and also we also would like to train some medical staff to be better prepared to discuss this with patients. Under the VP6, we've got 3 different activities. I will describe one of these little in details, but the others are COPD, early detection. We just start to cooperate with our partners, so it's still under the development process, and we will try to present some solution to start recognizing this important health issue earlier. And very interesting for us, and I suppose also for National Health Fund, is the VP 6.5, because it's about the role of the primary and secondary healthcare, the division of work. We know that the costs start to grow up if we move up to the pyramid of the medical services. And for us, it's also important to give our patients a good and easy access to the medical services. So in this task, we will discuss this issue. Also, there's a very interesting problem of, for example, COPD and asthma, because especially asthma, which in some countries are cured and it's under the interest of the pulmonologists. In Poland, most asthma cases is under the allergologist care. So we also need to discuss this issue, and because it's important from the result and recommendation. And I also think that in this VP will also need help of the National Health Fund, because it's the most reliable and institution in this area in Poland. I will, as I mentioned, I will describe a little more the VP 6.1.1. It's a tool for early diagnosis of asthma. From our previous study, we know that there's a huge number of people who live with asthma and other allergic diseases without proper diagnosis. They are treated symptomatically, and it generates costs. It's not efficient, and what's more important, it's not good for these people. So we would like to introduce the new eHealth tool for early diagnosis of asthma. What is the most important here? From our previous study, we know that based on the questionnaire declaration about the symptoms, about the situation when our patient have got exacerbation, we know we can calculate the risk of the certain health problem, especially asthma. So we would like to first develop the screening questionnaire. We next are going to conduct collect the data from outpatient clinic about the symptoms, how the patients describe their symptoms, and also what is the medical diagnosis of them. Next, we will try to create an algorithm using the big data approach, especially machine learning. And next, we'll introduce a new tool which will automatically calculate the risks of asthma in certain cases. In other way, the patient will fill the simple questionnaire. The questionnaire will consist of about 26 questions, but some of them are only asked for patients with the certain symptoms. So for most of the people, there will be about 5 minutes. It's not much time, and they will receive the information about probability that their symptoms are connected with asthma. And this is the pre-medical assessment, because of course it needs to be next evaluated by their primary care physician, and next by allergology clinic. We are going to conduct a study which will base on the 4,000 patients. Will collect data about their symptoms and medical diagnosis. And comparing these two data sets, we will receive our algorithm for diagnosis. Because we spent a lot of time on the medical research on the multimorbidity phenomenon, we know that we also need to ask about other medical conditions. So this part will be probably filled by the nurses based on the medical record of the patient. And next, our patient will receive the questionnaire with the, as I mentioned, 26 questions about the symptoms and general health status. We will think that it takes about 5 to 10 minutes to fill. The 10 minutes if someone has a lot of different symptoms. 5 minutes for people without most of them. And next, for that, we would like to use the Lyme survey tool. It's very interesting because this online questionnaire survey tool gives us opportunity to create a questionnaire in multi-languages. So in Jared project, we'll cooperate with 3 to 4 countries. All of them will collect this data. Okay. So in that way, we can create one system and all data will be gathered in one database and available for all partners. So I hope it will help us in the cooperation. So in the end, based on the symptoms, we will create a pre-medical diagnosis and send patient to the proper physician. And that's all. Thank you very much. If someone would like to ask us, please contact us by email. Unfortunately, I need to go because at my university we've got a Dean's Council in 20 minutes. So forgive me and thank you for the invitation. Goodbye.